More about the congressional vote later today to repeal health care reform. We expect to have both congressmen on the line to discuss it in this segment. Right now, let's start with Democrat Brian Higgins of South Buffalo. Congressman Higgins, thanks for being here.
Good to be with you guys.
How do you think you'll vote today?
I will vote to reject a repeal, and I think that this is not productive. We should be doing a bipartisan debate about how we make this bill better. In fact, the former United States Senator Majority Leader Bill Frist, a practicing surgeon, a heart surgeon, came out yesterday and said that the bill should stand, and the bill should be used as a basis from which to make it better. If repeal succeeds, seniors will lose about $500 in drug coverage this year alone. People will continue to lose their health care because of the explosive growth in health care. Over the past 30 years, health care costs have grown by almost 10% each year, far exceeding the growth of the economy. It's punishing individuals. 860,000 people go into personal bankruptcy every year because of medical debt. The deficit is out of control. This bill, if it stands, will reduce the deficit by $230 billion over 10 years and $1.2 trillion in the out decade.
Brian, Republicans, though, say if the bill stands, it's a job killer, and they say it can't stand, it needs to be replaced. Can you your thoughts on that as a job killer?
Yeah, there's no basis to support that assertion. In fact, what's killing jobs and what's making us non-competitive is the high cost of health care. It has to get under control. The fact of the matter is we have certain conditions within this bill that will not allow insurance companies to deny coverage for pre-existing conditions. It can't deny coverage for certain cancer treatments that are very, very important to Buffalo, Western New York, and the nation. And we need a more efficient delivery system. We need to get costs under control. It's the out-of-control costs that are hurting the economy generally, that are hurting job-creating businesses, and are hurting individuals.
The Senate certainly isn't going to go along with the idea of repealing this, but it sounds like, based on your remarks, there's at least a little bit of a consensus maybe on change. What kind of things do you want to change in it?
Well, I think persuasive alternatives to the existing bill are something that should be considered by Congress and members of both parties. We want to hear good ideas. Everybody, to a person, everybody says they support health care reform in the abstract. And when you put detail on it, then they begin to move away. These are tough issues. Issues have been deferred for many, many decades. Both Republican and Democratic administrations have advanced health care reform. This is a very market-based approach toward changing the way we pay for health care, getting away from fee-for-service, toward changing the way we deliver it, more quality, more patient-focused. It's the kind of health care that's delivered at places like the Cleveland Clinic. The Cleveland Clinic, the Mayo Clinic, Johns Hopkins, they should not be the exception. They should be the rule, given the amount of money that Americans pay for health care, over $2.5 trillion a year, 17% of the entire economy.
So you like it all? You'd change nothing?
No, there's a lot I would change in here. I would be much more aggressive about the establishment of what's referred to as accountable care organizations, which would pay organizations for medical outcomes and not fee-for-service. This bill sets up a demonstration project. We should be way more aggressive about mandating the establishment of accountable care organizations. Why is it in today's day and age that hospital infections are going up, not down? Why is it that hospital readmissions are going up, not down? Why is it that mistakes? We do 60 million surgeries in this country every single year, and over 100,000 people die from preventable mistakes during that surgery. These are the kinds of things that we have to hold healthcare providers accountable for. And look at it this way as well. For-profit insurance companies, CEOs, on average, make $12.5 million a year. We pay primary care physicians $148,000 a year. We pay nurses $45,000 a year. Where is the health care dollar going? It's not being invested back into health care, and that's why America continues to slide. We're 37th in overall quality. We're 41st in infant mortality. We're dead last of any industrialized nations relative to preventable deaths. America can do much, much better, and I think a bipartisan effort toward the goal, as Senator Frist has said, who is a heart surgeon. Use this bill as a basis from which to make the bill better. I have always said, upon the enactment of health care reform, that this is not a finish. It never represented a finish. It represents a start.
Congressman, the topic's a lot bigger than the time we have left. Thanks for your time this morning.
Thanks very much for having me.